Hello, everyone, and thank you for joining today's discussion as we celebrate Mayor Broom's Healthy City Initiative and highlight the 2018 and 2020 Community Health Needs Assessment. My name is Ellen McKnight, and I'll be moderating today's discussion. Today, we are going to be talking with the Behavioral Health Coalition. They are going to introduce themselves and let you know all about the dynamic work they're doing in the community. Jan?
Hi, I'm Jan Laughinghouse, and I am the Executive Director of Capital Area Human Services. Capital Area Human Services provides behavioral health, prevention, developmental disabilities for a 7-parish area.
Hi, my name is Chantel Jacobs. I'm an independent licensed professional counselor supervisor, and I provide counseling to individuals, adults, and teens in the community.
Hi, I'm Jamie Simpson, Chief Operating Officer of Lifeline Behavioral Health Systems, and we contract with Baton Rouge General to provide inpatient and outpatient services to the community.
Hi, I'm Charlotte Claiborne, the Executive Director for the Bridge Center for Hope, which is Louisiana's first ever crisis receiving center who's going to provide crisis stabilization services here in East Baton Rouge Parish.
Hi, I'm Bryce Mahundro, a senior clinical pharmacist at Blue Cross and Blue Shield of Louisiana, and also the chair of the Baton Rouge Health District Opioid Task Force.
Thanks for having me. I'm Denise Dugas, and I'm the Senior Director of Mental and Behavioral Health Services at Our Lady of the Lake Regional Medical Center.
Thank you, Ellen. I'm Joyce Plummer. I'm the Federal and State Grants Coordinator for the Office of the Mayor here in the city, parish, and I serve as the Project Director for RECAST, Baton Rouge, which is Resiliency in Communities After Stress and Trauma. And we'll talk about that more as our discussion goes.
Well, thank you all for being here today and all the amazing work that you do in our community. So let's just jump into it, shall we? Okay, so COVID has taken the Band-Aid off of the mental health, behavioral health space, right? Exposed so many different things. But the good news is that you all were doing this work prior to COVID. Can you please explain or expound upon why this work was important then and why it's so very important now? Go ahead, Ms. Jen.
I think the most important thing is that when you get a coalition, you have people who are from different backgrounds. We have different areas of training, but we also have different strengths that we bring. And we bring those things out of our silos where we tend to practice, and we live in these echo chambers because all the people around us do the same thing. Mm-hmm. And so it was good for me to get to be able to talk to Denise and talk to Charlotte, because these were folks that I didn't always have the chance to talk to. I knew of them out there somewhere, over there, Our Lady of the Lake and the Bridge Center for Hope. But to be able to connect with them in that way and not work at cross purposes, but to work together. And so that was the work that we did before. But as the pandemic goes, we know that at times of stress in the community, behavioral health needs do not decrease, they increase. So it put a spotlight on our work that had not been there before. So it just magnified our need for not only supporting the people in the community, but also supporting the helpers. The helpers need help too.
Absolutely.
And the beauty for me for this coalition is we all bring something to the table, and we all know the different challenges that people with behavioral health illness and needs have. So it helped us to identify who else needs to be at the table, who else are the stakeholders, housing, law enforcement, judicial system. So, we identified the gaps that this population is faced with, and we help bring all those stakeholders to the table to have those meaningful conversations.
And if we look at a positive thing with COVID, it really has taken off some of the stigmatism of mental health. And so we're able to get the word out more because people are willing, they're wanting to listen because they need more services at this time.
That has been one of the issues we dealt with in RECAST, trying to destigmatize the work that we do and the services that we offer. We started before the pandemic, of course, as every other group. So we've been doing mental health for 3 years. The mayor's office received a Sampson grant back in 2017. We're focusing on behavioral and mental health, on violence reduction, interventions and prevention, dealing with first responders in terms of training, and the general things that you would expect when you're trying to reach vulnerable youth and families. And all of a sudden, we have our own little coalition working, bringing together grassroots organizations, government officials and agencies and entities, and here comes a pandemic. We thought we understood crisis because we came out of the Alton Sterling shooting, the events of the summer of 2016, the flood, the ambushment of our law enforcement officers, and the trauma that was in this community already. But who would have thought that this pandemic would have energized and brought together? I mean, it's almost as if it cemented the commitment to work together, to not regard the silo or the jurisdictions that had existed before, but to recognize we needed each other and we were going to be committed to the work and not necessarily to a name or an agency, but generally getting mental health services actively, effectively in Baton Rouge. And it's just been amazing to see the work that has taken place in spite of and maybe because of the pandemic.
You know, one of the things that I've learned with COVID is not only did it take the Band-Aid off, it also exposed us. And it allowed us to be more innovative, to be more creative. It allowed us to get out of our offices, to get out of our what we used to do all the time, to start figuring out what we need to do, because we didn't have people coming into our offices anymore. We didn't have people coming into the hospital. There was a time right after the pandemic, during March and April, where it was radio silent.
That's right.
We didn't know where everybody went. It was kind of like after the Katrina, where you lost a lot of people and you're trying to figure out where everybody is. So it allowed us to start looking at behavioral health and mental health in different ways, in ways that we would have not have looked at had we not been forced to try something different. And so out of this, not only are we coming up with new innovative technologies and ways to be able to reach other people, it's helped us as a group to be able to come together, because before we would have all these meetings in person. And now with the pandemic, we're having all of these meetings on Zoom and whatever, WebEx or whatever we have to use. And so you have more people that are more willing to participate.
That's
So we have a larger participation now than what we had prior to the pandemic.
And I think I have a better understanding of the resources that are available in the community than I did before because of all those conversations as well.
So as a result of the pandemic, it's caused you to use new and innovative ways of communication, right? Have a better understanding of the needs of the community. And then also magnifying the work that you were doing, but encouraging everyone to engage with a more inclusive model. So the silos are gone and we're committed to inclusion, right? With that being said, now that we are in this pandemic space, are there any new needs that we didn't have before? We were doing this work with the mayor's office, you have a general idea of what the community is in need of, but is there anything new that you have to address in this field and in this space as a result of the pandemic?
Two things that jump right out at me.
Come on.
And I remember that we were having weekly calls, right? Remember when we got into the pandemic, right in March, we were having those weekly calls. And I remember Denise talking about this, the type of trauma that our first responders were going to undergo. Because we're talking about people who, by their very nature, have to deal with sickness and death on a daily basis. But when we're talking about all of the thousands of people and then they're dying alone, nurses having to use their telephones so that people can FaceTime their loved ones and talk for the last time. It was just something that they had not been prepared for. Like when I taught little baby social workers, I would tell them, okay, what they taught you in school is not going to prepare you for seeing somebody on the hoof, right? When they really have this disease that you have read about. Or these challenges, and this is where the rubber meets the road, and it's all different. And so when it became go time, I think people just kind of kicked in, but we saw first responders coming apart at the seams, and very understandably so. And I remember Denise speaking about that. Also, people, and this is something that you were talking about, Janice, and Dr. Plummer alluded to, removing that stigma, because people who did not have a recognition or any realization about behavioral health problems before, they have them now. People who have never thought about seeing a psychiatrist, a doctor, or talking to anyone, people are starting to have pharmaceutical distractions so that they can calm their mind. So people are developing habits, and we understand the behavior because people are just trying to cope. I've had those moments where I was like, stop this train, I want to get off, and if you don't let me off, I'll jump. And that's me being a therapist and having been a therapist and knowing how to cope. So first responders for me, and also people who have never been in this space before who are now here.
I can attest to that. I think the pandemic has shown that mental illness, emotional distress, or lack of resiliency for some people has no socioeconomic factors. It hits everyone at any time when there's a trauma in their life or a stressor. And yes, the pandemic has really magnified the need for emotional support, behavioral health support for people that have never thought they would need that support before.
And so for me, what I've gotten is a lot of calls from family members in other states that can't get here because of the pandemic. They can't get to their loved one and help them cope or go through because they have restrictions in their city, or we have restrictions here in Louisiana. So they're calling and saying, well, I need you to help me so I can help them. And we're having to send people out. So that was a big stretching point for me, because I'm trying to figure out how can I help your family member, then help you because you're stressing out because you can't get to this level. I've had several people call saying that they've had family members in the midst of wanting to commit suicide. So I've had to call 911 because they're out of state, so they can't call 911. Having one on the phone talking to 911, giving the address and trying to make sure that they meet the needs of that particular person that's in distress, make sure that family member is calm at that time. So you're having all of that in a pandemic, because beforehand, they could come and they can kind of just talk to that person, or whatever they were going through, they'll be able to say, well, I'm on my way. And they're not able to do that right now.
And I will say, too, as it relates just to trauma, early on, the initiative focused on making East Baton Rouge Parish be a more trauma-informed city. And so through that collaboration and partnership with Louisiana Department of Health, also with the Family Partnership Health Program, roughly about 30 individuals were identified to become ACE educators. And so I'm an adverse childhood experience educator. And so we're very proud of this program, because the purpose and the significance of the program is to educate the community about trauma, looking at childhood trauma, but focusing specifically on the impact that it has on one's brain architecture, how it can impact one's physical health and also mental health, but also social functioning. And so right now we're seeing a lot in the community as it relates to trauma. In East Baton Rouge Parish, we've already been through so much prior to the pandemic. And so we're continuing to experience trauma and also toxic stress. And so as it relates even to toxic stress, we know that that can certainly cause a person's immune system to be compromised and for individuals to get sick. And so we've seen an increase and an uptick on individuals wanting to know more about trauma, adverse childhood experiences. And so we're able to educate the community, but not only educate the community, also support those efforts in the community. So we're seeing companies now saying, what can we do to improve our systems? How can we be more supportive of individuals? Because it's not about what is wrong with you, it's what happened to you, and how can I help you get through this situation?
And then Jan mentioned the prescription drugs and kind of going to that. So for the opioid and controlled substances, we did a lot of community events pre-COVID and did everything, big drug take-back day and all of that. And so we had to shift from having a big community-wide event to doing media appearances and social media, and we did some Facebook Live, different things, and all the children being at home, all the parents being at home, access to everything, and trying to really make the community aware also of that danger. Okay, now you're all home, the kids have access to these medications, and that's where a lot of the opioid and other substance use disorders start, are in the home. And so really trying to educate differently than we have in the past.
Yeah, the issues beyond COVID is what we tend to have kind of put to the back burner. The elderly in nursing homes, they cannot leave, they can't see their families. You have elderly in independent living that they're secluded to one room and have been for months. And so we forget the effect that it has on them. And I think with this coalition, that helps us bring them services because it's a lot for them to handle.
We have a service provider in particular who focused on that for us at the beginning of the pandemic. Rural Services of Louisiana in the North Baton Rouge area actually made calls to seniors confined to their homes in the beginning of the pandemic to make sure they had food. If they needed transportation to go pick up drugs or to hospitals or other care, they were one-on-one, 24-hour hotline, not a crisis line in the sense of, oh, there's some acute traumatic event that has just taken place, but rather this is in fact, the Robinsons called it a warm line. We care, what can we do to help you, to serve you? And so many of the partners that work with us were willing to make the innovative steps or changes in the way they deliver goods because like everybody else, they were accustomed to doing in-person services. Our community services division, I don't think that we realize just how active the police department is in addressing trauma. Last year, they presented 4 different camps for youth who were at risk to understand that we're here to serve you, to guard and help you, and you don't have to be afraid of what you see on TV or some of the portrayals and some of the realities of life and interactions, particularly in economically deprived communities. That deprivation exacerbates whatever is taking place already. And so the pandemic just exposed the distinctions, who can get access to care, who could not get access to care. And we had many, many partners to step up. Family Services providing 24-hour crisis counseling to our first responders. And if I start calling names, it's just gonna get to be, I'm going to forget somebody, and all of them were just fantastic. I know HealthyBR is doing, we fit into that, but I'm so proud of the work that Recast partners have done over the last few years, and particularly how they have evolved since the pandemic to begin to shift to the virtual communication. I had no idea, could not have conceptualized that you could have healing circles with youth to train them in peer support and that type of, not therapeutic interventions, but peer counseling to teach them amped learning styles for educators. And so much that is taking place in the city, we do not appreciate sometimes what is happening under the radar. But we have phenomenal, committed servants in this parish that are doing great work to help us continue to become even more resilient as a community.
I definitely echo those sentiments. And you mentioned all of the different partners that you have with the Recast program and how you've been able to stretch those branches all across the community. I will definitely say, even though my background is in human nutrition and I have a master's in public health and all that jazz, I didn't learn what trauma was until the pandemic. I didn't learn about adverse childhood experiences until the pandemic, because people had an ear and to the ground as it relates to what you all bring to the table, because it's not our scope, it's not our space. So you said you don't want to list too many other partners because you'll forget some, but we're gonna lift up some of those partners right now, because each of you all mentioned the partnerships, right? Which partnerships or what partnerships come to your mind that made the most significant impacts across the city? So when you think about the work that you've been doing in this time, I'm gonna say it again because I know it's a lot of them. So when you think about the work that you've been doing during this time and in this space, which partnerships stick out the most to you as it relates to impact?
Can I say all recasts?
Come on, say it then, Dr. Plummer.
Partners.
Say it then.
I can just, I can't probably name them all. You know, if I try to think down, a Kingdom Connection Changing Lives, working with youth, providing at home, after school care to make sure there is not this regression, particularly during the summer months when kids are out of school, and how that has been impacted with COVID. They're at home. They were at home in the beginning of the year, and how it has continued. Storytelling through a Sissy House. Big Buddy does their Level Up. We work with them. Cure with Love Strategies. Oh my goodness, Emmanuel Milton, phenomenal. Comes up with a Spark Box that gets national attention. Eternal Crisis Outreach. Family Services of Greater Baton Rouge. I know I'm going to miss somebody. Dr. West with Humanities Amped. You know, the work that is done every day with UREC and the Y, and even with the Office of the Public Defender, who would go in and take indigent defenders who needed social services, mental health, because a lot of times you get caught up in addictions and end up in the criminal justice system. You're already at a disadvantage because you don't have any money. You don't have resources. They can't do an alternative program for you, and you're just kind of stuck. And to have the public defender who had a social service arm, particularly focused on making sure there was someone, a clinical social worker, to go in and address the behavioral health needs, the mental health needs of individuals caught up in the criminal justice system. We just, again, just amazing partners. And if there was a way I could just say, yay, for all our group, they're wonderful. And then we have I call them the bridges. The Bridge Agency and the Bridge Center for Hope. And it's amazing because BRPD Community Service works in collaborations with these other groups. The Bridge Agency did a suicide intervention virtual series over a four-week period for youth to help them understand, for law enforcement officers to help them understand that when you have these ideations, it's not abnormal in the sense it's a normal response to trauma. And these are the services that are available. And so I could just continue to talk about this group is great.
I think you've done a good job lifting up the partners. You said, I don't know if I can do it, but I think you've done a good job. Anyone else who would like to lift up some of the partnerships?
I do. State agencies, our regulatory agencies, I think really stepped up to the task. It allowed Baton Rouge General to open a psych hospital for COVID patients within maybe 15 days to a month. And they really, so the state agencies and providers really came together on this. Very proud of them.
Absolutely.
And Dr. Plum.
Ask for more.
For the woman who couldn't remember everybody. I think for us, for Capital Area Human Services, being able to coordinate and reach out to the hospitals and being able to help, we were able to provide behavioral health support at the COVID testing sites. Because people were upset. I mean, you know, it's like, oh my God, I got a plague and now I'm gonna die. And you had to be prepared to talk to people about what was going on. Or, you know how in the beginning, everybody couldn't get a test and, you know, people were upset if they couldn't get tested. We were able to have social workers there. Like you said, the state called us in and we were out there. Our Lady of the Lake was out there, Baton Rouge General. Everybody took a turn. As I said, all of the territoriality went out the door. I think that's what has been the blessing of this for me. Our school-based social workers have been able to work with the principals of folks across the seven parishes that we serve, so that we could continue virtual services for our children and their parents while they were at home, all having all of that family time together. Too much of any good thing, I tell you, I experienced that personally. But just a lot of the law enforcement, just all of the people who stepped up. I mean, people just, they suited up and they showed up in this time when everybody needed to be present. So
I think the other
yeah.
side too, like you mentioned the hospitals, but also the providers and the provider offices and the payers out there that switched to telemedicine
Yes.
and services just basically overnight. A completely different mindset and different way of seeing patients, but they wanted to make sure their patients were seen, knew they were comfortable, and were able to make that happen.
Yeah, and the DEA who let folks prescribe buprenorphine over the phone.
Yes.
You know, that was unheard of. Telephonic services, not just teleconferencing or virtual services where you could see somebody, but over the phone, so that we could get help to people who needed it. I agree.
See, for me, I'm completely different from all of you all because I'm unique in the sense that we are a crisis receiving center that's not open yet.
Yes.
We've been in the works for 4 years, since 2016, and then we had the tax passage in 2018, and we had to spend all of 2019 collecting the funding and trying to get citizens. And so when people start reaching out and looking online for crisis services, our name pops up, and so they call us, and so I'm calling Dr. Latham saying, hey, I have this person and they need this services, and I'm directing people to them, and I'm calling Denise saying, hey, how many beds do you, are y'all full? And so I'm directing to all these different locations because as of right now, I personally can't help you because I'm not open, but I know people who can help you. And so I find that I'm more of like, I call it airport traffic control system type, where I'm directing to this, and I'm sitting there talking to all these people, and I'm saying, well, what is it that you need? I'm not hanging up with you. I want to know what you got going on. And I said, okay. And I'm calling you and saying, can you help this person? You go, yes. Or can you help this person? I say, yes. So for me, I will say everybody, because I'm calling law enforcement because they're part of my board. I'm calling the Chief Public Defender's Office because he's part of my board. I'm calling the Coroner's Office because he's part of my board, because I'm having to deal with all these different crises. And I'm just one person trying to direct everybody to where they need to go.
It's
Well,
good
Go
practice
ahead.
for when you're open, because that's what you're gonna do.
Well, yeah,
Yeah.
but in the meantime, but for me, it's really the whole parish that's
Yeah.
been able to help me. So I can go down the line with the coroner's office, the BRPD, the sheriff's office, capital area, Our Lady of the Lake, Veterans General for me. So it's all of those entities that have been able to help me.
And I would just mention, as I mentioned earlier, as it relates to adverse childhood experiences and that program, Louisiana Department of Health has definitely been very helpful, very supportive, along with the Family Health Partnership. And as it relates to the educators, they come from various backgrounds. So we have state representation. We also have the school system, nonprofits, behavioral health social service programs. So all of those individuals have been very supportive.
And St. Vincent de Paul.
And St. Vincent de Paul.
St. Vincent de Paul, yes.
Okay. You listed so many organizations, and you say you guys aren't open yet, but I feel like you're living true to your name by bridging the gap. And so the bridges, you talked about the bridge agencies. So so thank you for that work. Even though you aren't physically open yet, you're still doing the work. All right, next month.
Next month.
That's awesome. Congratulations. Yes,
I can't let
ma'am.
it go without mentioning our frontline workers, our nurses,
Oh, yeah?
doctors. I've heard several nurses say, I'm used to losing people, but not this much.
Yeah.
And they're used to taking care of people, and they're not allowing people to take care of them. So that's a population that's been very hard to penetrate, to say, hey, we can help you. We can help you. Please reach out. And so we've started a support group on Wednesdays for healthcare workers.
This is a little off script, but in this space, you guys are teaching me so much. I'm wondering if there was Q&A, this would be a question. Is there any behavioral health? Are there any behavioral health services, or have you all found that there's a need for more behavioral health services for moms in this time period? Because you talked about being stuck at home. You talk about caregivers or frontline workers not being cared for. And I think about moms who are caring for so many people, but not necessarily, receiving any care. So from a behavioral health standpoint, mental health standpoint, Is there anything in place for them?
I don't know, but I don't think they have taken a step back to really realize they need help. I think right now everybody's so busy just trying to maintain and keep everything, all the balls floating in the air and making sure nothing falls apart. And I think that once they get a moment to just kind of breathe, then we'll see. Because with the pandemic, everybody's just trying to maintain and just keep everything under control. And when we thought we had a breath, our overdose rate skyrocketed. So we were not to talk statistics, but East Baton Rouge Parish has surpassed the number of overdoses from 2019. In 2019, we had 127. As of right now, we have over 189. So I think that with moms or any type of caregiver, they haven't taken that moment to just breathe and really realize what they've gone through, because they may have lost loved ones, and during this time, they may have lost their jobs, they may have lost just a child, anything. And so I think once we all can get a collective moment to breathe, then we'll see really what's out there and what the need is, and so then we'll have to pivot again.
It's like the cost of war.
Yeah.
Having worked with veterans, we know that when we have people who have been in active combat, we don't know the cost of war, the emotional cost, the behavioral cost, until about a decade out. And so what you're saying is we'll be seeing these effects for a long time. For some people, they haven't even fully shown up yet, is what you're saying, because they haven't stopped. They're just doing. They're not living, just existing, right? Just kind of surviving, trying to keep their head above the water. And so when people get a chance, as we just, this is our new normal now, on wearing masks and socially distancing and doing all of these things, as we begin to come out and turn the corner, people will look back and, oh my gosh.
Yeah. Part of our focus as a coalition, and we're going to be pushing that more in the upcoming 3 years, is the integration of primary health care and behavioral health care, where a primary care physician or group practice will have a footprint with a social worker and telemedicine capabilities with psychiatry, because what we spoke of the females and people that are juggling all these balls, they're going to go see their primary physician first, and they may start exhibiting symptoms that they don't really know what's going on. And it's so important that a primary care physician with a behavioral health collaboration identify the issues and the emotional distress and treat it, whether it's through therapy or medication, before it becomes a crisis, before they start doing drugs or alcohol to cope with that distress. So as a coalition, we're really going to be pushing primary healthcare providers to open up and allow behavioral health social workers and psychiatry into their practices.
And I think that telemedicine part is very important for that mom that we're talking about, because she's at home with her kids. She's trying to do virtual school. She's trying to do her job at home, and she can't leave the house to go take care of herself. And so having that as an option, I think, is huge.
And I would also say too, just to piggyback on what was said, individuals, they're on autopilot. And so you are going a mile a minute. You don't have time to pause. You don't have time to stop. But another thing that we're working on as a coalition is resources. And so education, awareness is so critical. And so we have sent out surveys in the community to providers to gather information about what is your contact information, because we find sometimes that change quite frequently. And so what are your service hours? What's the criteria in order to obtain your services, etc.? So our goal is to be able to provide just a comprehensive list to the community so they can use this resource guide, and it's up to date. So that's very key. And so many of us have some outdated lists.
Yes.
And I think the other part of the surveys wasn't just, hey, what services can you provide, but hey, if you were to use this, what would be helpful to you, and how would you use it? What format would you want to make it the most beneficial?
Which is something I was pushing, because the Bridge Center, it has to use all these providers, because by being a crisis facility, you are going to refer these people out once they leave the facility. And so when we were initially talking about the survey, I was like, I needed to be comprehensive for my work group, because we're going to update it more so than the Behavioral Health Task Force. So that's something that I'll provide, because we'll keep it updated every month, because we're using it every month to make sure that we have this, your phone number's correct, or your address hasn't changed, or you've added another location.
Right.
So we'll be, as a coalition, in conjunction with the Bridge Center, we'll be able to keep that list updated, and then we can be able to add more to it, and they'll be able to use that in the community. Providers will be able to use it. The mom who's looking for a provider will be able to use it. The providers looking for a collaborative service will be able to use it.
Denise and I were talking about discharge planning for the clients in the psych hospitals, and it's become severely difficult because let's think about domestic violence. That has increased tremendously. So let's say they end up in our hospital, it's really hard to find some place for them to go. And so this comprehensive list is really going to help in finding resources for people coming to our hospital.
In our last opioid task force, we talked about also the violence that's been related to the substance abuse and all of these other issues too, and how that also plays a role into everything.
You said the violence?
The violence, and not just domestic violence, but like drug-related violence,
Right.
and trying to get those coping products.
And we are seeing an increase in behavioral disturbances in children and adolescents. It has really peaked. It always does at the beginning of the school year, but it has really peaked because of the pandemic. A lot of kids having emotional disturbances, in a crisis, either coming from school or, their homes. So this is very traumatic for children, very traumatic.
Bring up a good point, because kids also feel isolated, especially kids that may say be the only child. And so they may feel alone, or they may be at home being homeschooled with their, at home with their family, but then their parents are busy because they're working at home too. And so it's that additional stress, and it's like, well, where can I go? Who can help me? And just being confused and not knowing where to go.
And I think we received a great response from the providers. We were able to get a comprehensive list.
So, we're wrapping up, ladies, because you guys have been amazing. But why is behavioral health essential for the city to focus on, for the community to focus on over the next 3 years? We've been hearing essential this, essential that, and one of the bright spots of the pandemic is people are paying attention to behavioral health. People are talking about therapy openly, like they never have before. But why is it essential that behavioral health remains essential even when COVID isn't so scary anymore, or after we have a handle on it? So over the next 3 years, you talked about over the next 3-year period.
I think we're just getting started.
All right.
And I say that because prior to the pandemic, behavioral health was always that, it's this person, or it can't happen to me, or is it not somebody that I know, or it's somebody that I used to know, or it's my friend's cousin, husband, brother.
Right.
And so now with the pandemic, it's opened up that Pandora's box.
Mm-hmm.
And the person who has a behavioral health issue could look just like me. It could look like you. It could look like any one of us. Because you have people right now that are going through things that they've never gone through before. They don't know how to cope. So now that veil has been lifted, and people are paying attention to things that we've been saying for a long time, now we have their ear.
Yes, you do.
So now that we have their ear, we can demand more. We can say, this is what we need to do. This is what we need to push that envelope a little bit further. And they're willing to say, okay, you seem to know what you're talking about, because now they're having to listen to the people who've been on the front lines for the longest, and have been saying, we're here, we need some help. And now you're coming to us saying, okay, we need you to help us. Oh, well, we've been here, we've been working, we've been doing a lot of things under the radar, trying to make sure that you don't lose your mind, I don't lose my mind, or I don't lose anything else other than what I have lost, or that and if I do, I can recover, or there's somewhere for me to go. So I think in the next 3 years, you'll see a lot of things change. because what we didn't know that we were going to have a pandemic in March. So what we did is, as a behavioral health agency or organizations, we pivoted and we rolled with the punches and we figured it out. And so because we were able to do that, it allowed us to be able to look at things in a different light, and it allowed us to be able to say, oh, you know what, we can do this. Or those things that we thought we couldn't do or we never tried to do, we're able to do them now, and even more so in a greater number. So I think 3 years is just the tip of the iceberg. And then you also have 988 coming along, which is it's kind of like 911 for emergencies, but it's for mental health. And that's something that's being pushed and talked about too. So that's coming up within the next 3 years as well.
And I think as a community, we need to own it. And we need to take responsibility and hold ourselves accountable as citizens in this community. We can't forget about the chronically mentally ill, those with the brain disorder, schizophrenia, or bipolar, who really struggle in life, and they can't help it. There's so many inequities for this population: housing, they're homeless, they can't get their medications, they fall in and out of the Medicaid rolls, and I think, you know, as a community, we need to wrap our arms around these people and support them and lift them up and help them to be functional, remain functional, and live a healthy lifestyle. You know, those people are so forgotten. Those are the ones living under the I-10 bridges. It hurts my heart to know how there's so many inequities for this population. And like I said, as a community, we need to own it and take responsibility.
I think the other thing too is that we already needed innovative ways to solve this problem. But I think one of the good things of COVID, like we've all mentioned before, is by ripping off that Band-Aid, now you've got that push to figure out what those innovative things are. You said we already pivoted. We already know that we've got to do some different. Y'all have all been doing amazing different things already. And so really expanding over the next 3 years on those innovations.
And also, behavioral health is health. It's been over a decade since we have had federal legislation that brings mental health on par with physical health. But we are failing in it. It is not unique to our state, unique to our parish. It is just nationwide. We are not treating behavioral health on par with physical health. And we know that the brain is a part of the body. I don't know why they behave like this right here gets everything. And when people have illnesses here, it's just like, you know, good luck and God bless. And so having that parity, understanding, you know, I think we would all be up in arms if we didn't have nurse care managers to help someone who has hypertension or diabetes navigate the system and get the support that they need. But what about someone who has a substance use disorder or a diagnosed mental illness? They need that same level of care. I come from addictions, and we know that it's one of the case management is one of the 12 core functions of substance abuse counseling, but we're not going to pay for it. So how are you going to have best practices when you don't have parity with behavioral health and physical health? So Denise was talking earlier about that integration. We have a clinic at Baton Rouge Clinic. We also have Open Health Care Clinic in one of our clinics as well. It is extremely important that people understand that behavioral health is health. There is no difference.
And
we all need
health,
that.
you're not going to get the outcomes that you're searching for if you don't treat the behavioral health.
That's right. That's right. You can't treat one without the other.
Experiences. There's data that shows your chronic conditions, they don't do as well.
That's right. That's right. They're more likely to make lifestyle choices. People who have lots of adverse childhood experiences are more likely to make lifestyle choices that are going to lead to substance use disorders.
And I'm actually closer to
Yes.
the chronic disease management than I am behavioral health. But I totally forgot where I was going with that.
Keep talking, but come back.
I do a lot with medication adherence, and what I tell people is medication adherence is a behavior. You can't treat it like a checkbox, did I do it, did I not do it? You've got to get down to the root of why. And I feel like this is the same thing. Like you've got to treat the behavioral health issues in order to treat the physical.
I think what everybody's saying is in the next 3 years, us to focus on integrated health.
Integrated
Yes,
health.
Absolutely. That's it. Health,
And we can
period.
focus on that in the next 3 years and really bring awareness to our physicians and
Okay.
integrate.
Yeah. Dr.
Trauma
Plummer?
is a fact of life. And it's a matter of what resources do you have to bring to bear to address that trauma.
Mm-hmm.
Research is showing that it can be transgenerational. We know it's connected to poverty. We know it's connected to crime. We know it comes out of ACEs. We know that we have to be proactive if we're going to address it. SAMHSA has identified that a trauma-informed educational program has to have information regarding safety, trustworthiness, empowerment, collaboration, peer support, and being culturally sensitive, understanding the historical context that people have to function in or operate from. And until we get a handle on that, and I think everyone sitting here is working toward that and working to be more collaborative in the way that we provide those other services. And it doesn't happen overnight. We've been working for several years. It's just getting started. One of the things we hope to do is bring a community-based, a citywide mind-body program to Baton Rouge. Center for Mind-Body Medicine is going to come in. The Office of the Mayor is going to collaborate with Pennington and Graff and some other agencies, Wilton, and see what can we do to inform, to support, to work with our frontline, our first responders, the people who actually do the work under that constant stress all the time. But we're just getting started. So 3 years, nothing. The rest of our lives, more like.
And I will say too that we can't be a resilient community unless we address behavioral health.
Absolutely.
And so behavioral health is at the core, it's at the forefront. And so it's time for us to begin to, as many of you guys have talked about, to shift our lens and to give people hope. And so there's so many people that are stressed and overwhelmed, they're suicidal, and it's affecting people's work performance. You have people that are not coming to work. I just spoke with the youth recently that indicated many of my teachers, they're not coming to class, and they keep saying they're sick, but what is that, So it's dealing a lot with the stress, the trauma of what individuals are going through. Many people have experienced so many deaths this year, or individuals that are sick, and so it's time for us to put that at the forefront, but begin to help people reach their full potential. Also, begin to look at individuals, what are your strengths? What are you good at? How can you utilize those strengths in the community or in your home to feel good about yourself, but also make the world be a better place? Because we all have something that we can contribute to our community, which can also impact our parish and make our cities even better and stronger. So sum it up, we're just getting started.
That's it.
Slow clap it up, people. Slow clap it up. Listen, ladies. See, this group, they said they were nervous. They look nervous? They sound nervous? Okay, they sound like they got it, right? Thank you all for lending your voice to this conversation. And thank you all for lending your time, your expertise, your talent, your experiences to this coalition, okay? As you all already heard, they are just getting started, so look forward to the next 3 years, okay? Because it's all the way up as it relates to behavioral health. If you would like to get connected with this coalition or the work that the Mayor's Behavioral Health Coalition is doing in the city, you can visit HealthyBR and get more information and get involved, get engaged. Thank you all for joining us. Thank you for your time, and we'll see you next time. Bye.